Today, we're talking about something that can make you feel completely alone because it sounds something like this. You're really tired, but your blood work looks fine. You feel off, but nobody can point you to a clear reason as to why you feel that way. And after a while, you start to wonder, is this maybe just all in my head? I need you to understand this. If you feel unwell and your lab tests look normal, you're probably not imagining it. Hey, I'm Nurse Healy. I've been a registered nurse with over 30 years of frontline and occupational health experience. I've spent a long time listening to people describe symptoms they were afraid to say out loud. So today, I want to help you make sense of the gap between something feels wrong and, well, everything looks normal. Because that gap, or sometimes it's a chasm, is where a lot of people suffer. Quite honestly, they suffer quietly. So here's the trap: you go and get lab work done, and all your tests come back normal. That can make people think two different things. So the first thing is, if the tests are normal, I should probably just feel fine, right? That would make sense. And number two is, if my tests are normal and I don't feel fine, then it must be anxiety or I'm going crazy or something like that. And this is a very common notion that people have. Most routine blood work and basic tests are good at finding larger ticket items, such like an infection or blood anemia, electrolyte problems or an imbalance in your electrolytes, maybe a thyroid that's out of whack, and potentially some major organ issues. But and all of these are very important, don't get me wrong, but these labs and various tests that we do and we partake in, they can rule out some potentially dangerous stuff. But what these tests and the results don't really do a good job at detecting is any kind of sleep disorder or chronic stress or overloads of any sorts. Side effects from the current medications that you're taking, what your diet or nutrition has done or undone over the last period of time. Any swings in your blood sugars, or maybe if you have any heart anomalies like rhythm issues or anything like that. But here's the key to all this: a person can look perfectly normal or fine on paper as far as that goes, and still be struggling in real life. When people say I'm not myself or I'm exhausted and I really don't know why, people need to think about what happens when stress builds quietly over months or years and how the body adapts to this. So, some certain things that can happen are your heart rate will change and your sleep patterns will change. Your As you age, your digestion shifts, but it changes more quickly with this. Your libido is going to drop once again with age as well, and so does your energy. But these are all different things that can happen with this as well. And the body doesn't always raise a red flag. Sometimes it throws up a cautionary yellow one too. So now let's discuss these. Let's call them clusters. So as symptoms often travel, let's call it once again clusters. These clusters can help tell a story. So let's call the first cluster Cluster A. So I've got brain fog and fatigue, and I'm relatively irritable. You might want to start thinking about, okay, what's going on with your sleep quality? What's your stress load like? Is there a possibility that you could be burned out? Are you recovering from any previous viruses? And maybe is it possible that you're depressed? So then, if we move on to another cluster, that could be classified as cluster B, where you could have things like maybe dizziness or shakiness, like I feel like I need to eat right now. That should start you thinking on maybe blood sugars and possible swings in those values, whether over caffeination, and that doesn't matter whether it's energy drinks or coffee or sodas, just over caffeinated, and anxiety that's exacerbated by other symptoms. And those things will all fall under cluster B. Coming up to cluster C would be something that's a little more threatening to people, and it's when they have chest tightness or shortness of breath or tingling in their hands. And what you have to think about at that particular point is whether it's, do I have a hyperventilation problem? Do I have a panic disorder? Is there any trauma that I've had to my musculature system? Do I have a history of asthma or any heart rhythms, arrhythmias, anything like that? And one of the other ones that we don't really think about very often is acid reflux. So that's also a consideration. So now let's talk about anxiety in this context, because anxiety is real, and anxiety can create symptoms that feel terrifyingly intense. But also, anxiety shouldn't be used as a brush to paint over everything. A good clinician will ask you about any recent life changes, something that anything that you can identify that makes your symptomology worse, anything that makes it better. Have your sleeping patterns changed? They should be asking you stuff like any new medications or substances that you've introduced to your life, weight changes, up or down. And the rationale behind this questioning that they're going to ask is to understand, because anxiety is often a layer and it's not the whole story. And sometimes the anxiety is secondary. Let's get this out of the way here and now. You're anxious because you feel bad. It's not the other way around. That matters. Now, I'm going to share with you something else. Normal tests are relatively reassuring, but they're not a guarantee of your health now or anywhere down the road. That said, if you have any of these symptoms, please be seen by a qualified medical provider immediately. And I don't use the word immediately loosely. So if you have new or severe kinds of chest pain, or chest pains with any form of exertion, episodes of fainting or near fainting, anything that affects your respiratory, especially when you're at rest, breathing that worsens, anything that's affecting your breath, inhale and exhale, and this worsening quickly. Any new one-sided weaknesses or facial droop that you've noticed, a change in your speech. Another good one is a sudden headache like you've never had before in your life. You've never compared this to anything. That's a really good reason to get treated immediately, especially if it comes with any kind of a confusion. And I know this sounds like a very extensive list, and that only covers a portion of it. But every one of these needs to be evaluated now and not later. And let's not forget, any symptom you recently or currently have that has escalated rapidly, so something that's changed and has gone on rapidly, that's another reason to get checked. And I'm not saying this to scare you. I'm saying it to give you clear boundaries. You've got a swim lane. This is the one you're going to stay in. So what I'm saying is you don't need to ride it out when you shouldn't be. If your tests are normal, but you still feel unwell, well, here's a smarter next step rather than panic. So step 1, track patterns for 7 days. Not forever, just 1 week. Write things down. What's your sleep been like? What's your caffeine intake like? Meals. Are you eating fine? Are you skipping meals? Are you drinking lots of fluids? What's your alcohol consumption like? What's your activity level? Any stresses and spikes that you seem to have noticed in yourself, or somebody in your family tells you seem to be a little bit more right? Any symptoms, and remember what their timing are like for anything that you're going to write down as this, as well as far as any patterns are. Make sure you record all this as well, and you take that to your physician next time you see them. Number 2 is bring one clear sentence to your doctor when you go and see them, or your healthcare provider. Try something like this. My tests were normal, but my function doesn't seem to be. Here are the patterns that I'm seeing, and that initial conversation, that starts by bringing it up like that. That initiates a conversation with your physician. And number 3, when following up with your healthcare provider, ask the right questions. Of course, depending on what your symptoms are, but do my current medications need to be reviewed, or should I be considered for sleep apnea? Do we need to follow up on my thyroid? any history of cardiac issues. So if I have had history of cardiac issues, should I have an EKG, or do I need to have a Holter monitor, or anything like that that you can bring up to them? If you have hypertension, so should we be reviewing this more frequently than we are? If there's stress in your life, do you require mental health support to get through this? The same thing with anxiety, if these are clearly driving any of your symptoms. But remember, not everything needs a specialist, but almost everything needs a plan. So let's circle back to this again. If you were told everything is normal, but you don't feel normal, you need to think about this. Your symptoms are information. That's what it is. It's information it's providing you. And you're not being dramatic by wanting answers. The goal isn't fear. The goal is clarity. And clarity, well, it gives you control. It's important that I explain this right now, and it's that the information that contained in this video, it's not providing personal medical advice. We're not providing diagnosis or treatment, and you should not be replaced by a consultation with your own primary healthcare provider. Please make sure you do that. This channel isn't about clicks and or likes. If you think what you've seen today might help somebody else, you're welcome to pass it along to them. Time, as always, keeps its own schedule. Thank you for being here, and thank you for trusting me with your time.